everyone. I'm Reena Chokshi. I am the Director of GI Motility at Baylor College of Medicine in Houston.
And my name is Joe Sujka. I'm an assistant professor of GI surgery over at the University of South Florida. So now we're going to dive into some of the data, right? I'm not going to bore you with a ton of slides. Each of these studies are 1-2 slides maximum. That's my limit when it comes to talking about other people's studies. But this is the French study. This is one of the largest randomized studies looking at Intera. And let me ask you, why have you not heard about this study? When did it come out? COVID, right? So that's why you never heard about this study. Ultimately, it came out at the height of the pandemic, and so while it has very good data, it didn't really get widely circulated. But generally speaking, it looked at 172 patients with refractory vomiting and Intera placement. And what they looked at was, did they have symptom improvement with their vomiting? Now, what's hard with this study is that the higher vomiting score is actually a good thing because of the actual scale they used. I would prefer it the other way around. The lower the vomiting score, the better. But just so if you read this study one day and you're looking through it, it sometimes makes it a little difficult to say. But we learned things from previous studies. There was another study called the WAVE study, which is a randomized study, but they turned on everybody for a month beforehand. And what we found was that there's a carryover effect of the device. Once you turn it on, it doesn't just stop working immediately if you turn it off. So this study rectified that problem with the previous study and made it so everybody had the device off for a month. And then they were randomized to on or off, and then flipped. And what they looked for was, what happened, right? Was the therapy actually effective? And it was. It improved vomiting. I'm just going to say that because if I say it increased the vomiting score, it's just going to make everybody scratch their heads some more. But generally speaking, it decreased median frequency of vomiting. And so that brought up a question, right? So now we have these patients, we have gastroparesis, our understanding is improving. Functional dyspepsia, all these other vomiting syndromes, ultimately probably overlap with gastroparesis. And so the question becomes, can we use Intera with its improvement in nausea vomiting to help this patient population? And thankfully, we're actually going to be doing an IDE-style trial with the FDA to look and see if the actual stimulator can be effective in functional dyspepsia patients. So one of the most common questions I get is, I have a gastroparesis patient who I think is gastroparesis, but their emptying study is normal. What do I do? And right now, the best guess we can say is, look, we don't have data to say if it's good or bad for functional dyspepsia, but in the coming years, we're going to be doing this IDE trial to expand the use of Intera into that patient population in the hopes of eventually able to help those folks. Because right now, they're sort of stuck between a rock and a hard place because there's really not much you can do for them. So the other study is the Washington WashU study. I'm not going to labor this one too hard because I think a lot of us were probably just sitting in the gastroparesis session with Dr. Awad. This is a very high-level discussion, basically saying this was a prospective study looking at 157 patients, specifically looking at hospitalization, nausea, vomiting, as well as satisfaction. So when you look at the actual study itself, at 1 and 5 years, nausea, vomiting, and GCSI was improved. That's the high-level takeaway from this. And that's really good because it shows that this is durable. But then when you look at hospitalization, that was also decreased. We're improving the quality of life of these patients, and also patient satisfaction was improved, right? I think a lot of us are afraid to treat these people because we're afraid that they're not going to be satisfied with what we do for them, right? That's a hard thing to square up with, and we have a lot of things we can intervene on where they are going to feel better and they are going to feel very satisfied. But you look at this, and these people who had this intervention have a very high satisfaction rate. And as somebody who puts these in quite frequently, I see that very commonly. People have an improvement, and they make improvements over time. It's just not immediate, like when you fix someone's hiatal hernia and their reflux goes away immediately.